Thanks for joining us again. I'm Lauren Maloney. Here with us this Sunday is Dr. Daniel Weiss from UVM. And the hospital just won an American Lung Association funding to really study the long-term effects of COVID-19. Doctor, I appreciate you being with us.
Oh, thank you for having me.
First of all, what are you seeing right now in terms of people dealing with lung issues from COVID locally?
Well, I think we've been fortunate as a state to have not been hit as hard until recently as the rest of the country and certainly other parts of the world. But now, unfortunately, the number of cases is rising. And there aren't that many patients in the intensive care units here compared to other parts of the country, but the anticipation is unfortunately that it's going to change. And so what does that mean in terms of lung involvement? The patients who do end up in intensive care are the ones who have gotten hit particularly hard by the virus, and they end up with their lungs failing, respiratory failure, and some of them will need to be put on mechanical ventilation, so they'll be put on ventilators, and that's quite devastating. And so anything we can do to prevent that in the first place, but also if we can understand better what happens to the lungs when the patients get that sick, then we can potentially come up with new therapeutic approaches over and above the ones that are already being investigated to date so far.
So you were one of 12 researchers selected for this COVID-19 Respiratory Virus Research Award, announced from the American Lung Association. You mentioned therapeutics. Is that the end game here, that the research really wants to help search out is more therapeutics?
Well, the American Lung Association is one of the leading nonprofit organizations dedicated to trying to cure lung diseases, but they also are hugely interested in prevention, societal impact, and everything that can go around lowering the burden of lung disease in this country. If you think about the American Lung Association and cigarette smoking, and they've been long a beacon of anti-smoking efforts across the country. So this latest action initiative, they call it a COVID-19 Action Initiative, is geared towards a broad-fronted approach. Some of it is to develop new therapeutics, which is part of what we're working on with the funding we received from them. Some of it is geared towards patient education. Some of it is geared towards better preventative measures. Some of it is geared towards understanding for the people who have COVID and make it through, what happens to them down the road, and what can we do to help lessen any type of potential burden of having had the infection once it's over.
And I know we're getting into medical terms here, but you specifically want to see how the virus damages the epithelial cells lining the lungs, correct?
That's correct. And so to put that into more plain speak, if you will, the cells that line the lung are the important ones for what we call gas exchange. When you breathe oxygen in, it's got to go from the lungs into the blood. And then everyone will remember from biology in high school that carbon dioxide's got to go from the blood into the lungs so you can breathe it out. And those cells are amongst the ones most particularly damaged by the virus when it gets into the lungs. And so if we can understand better exactly how the virus does that and try and mitigate that and come up with new, again, therapeutic approaches to lessen or even prevent that infection of those lining cells, those epithelial cells, then that could be a significant advance.
Now, will this study help active patients with the disease right now, or also, we hear about those long haulers who even after they've recovered are still dealing with symptoms?
Well, I think the initial target is going to be those dealing with the active severe disease, those in the intensive care units, those on the ventilators, because that's the most critical short-term population, of course. I'm hopeful also that whatever we learn will be in fact applicable to people who have long-term sequelae, but we'll have to see.
Is there a focus too on people with, you mentioned smokers or asthma, pre-existing lung issues, if you will, how the virus interacts?
That's a great question. And I think the more we learn about what the virus is actually doing, again, to these epithelial cells lining the lung, then we can take into account those who already have had previous disease or previous insult to the lung, let's say from cigarette smoking or from a disease like asthma or emphysema or any other type of lung disease. So it's all part and parcel of it, but one step at a time.
Yeah. Doctor, finally, what has surprised you or challenged you the most when it comes to this disease that a year ago we knew nothing about?
Well, I think there are a number of ways of answering that. Scientifically, we need to understand better exactly how the virus does its damage. There's a lot of good knowledge that serves as a platform for increasing that knowledge. So again, we can use that to develop new therapeutics. But I think also, too, is that what this virus, what this pandemic has illustrated is the fact that there are so many other measures that need to be put into place. And you know what they are. This is the physical distancing, the social distancing, the mask wearing, the common sense that helps prevent people from getting sick to the point where people like me need to step in and try and do something.
Okay. Doctor, I appreciate your time. Thank you.
Thank you again.